for doing this is through our work groups with Choices for Care. As some of you already know, some of you aren't aware, we're making some changes within the traditional home-based services, the Choices for Care, in response to some updated Department of Labor rules. So part of this is that we're going to be authorizing our services in a budget format. And then the second part is that we've continued to move to using a paperless system. So while we were making the change for budgets, we have decided to embed the service plan into an electronic assessment that we already use. So that means that the paper service plan, which I think filters through your agency, is going to go away. And that was brought up, that point was brought up during one of our Choices for Care work group meetings, that, you know, if we no longer have a paper service plan, then home health agencies are going to need another way to get that same information. And so it was an additional opportunity to then connect with all of the folks who do billing at the home health agencies to have you become SAMS users. So that way we can show you how and where to access information. So part of the goal today is just to ensure that you're able to log into SAMS. I want to show you how to navigate within SAMS and show you where you can access information. There's a couple of different ways to do that. And then certainly if there's any additional resources that you think would be helpful or other, you know, potential system improvements too, I'd love to hear about that and what your thoughts are. So I think for the purposes, since it's just your group today, if you have questions along the way as we're going through navigating SAMS, you can either use the chat function or you can just speak into the phone. So any questions before we get started?
Just one question, Sarah. I do have Lisa Lutton, who actually works within our department, who usually has received the paper plans of care, as well as Rachel Billing. Now, as far as the SAMS login, do we communicate with Dick to get those added logins?
Yeah, you would want to connect with Dick or Rio just about additional logins if you need them.
Okay.
Yep, that would be great. And okay, and I just also want to clarify too. I know this question has come up with some of our other groups that, you know, we are not able to use SAMS at this time to do any electronic bill submission. So the purpose of this is just to be able to access the authorized service information at this time. So currently SAMS is not connected in any way, shape, or form to VIVA or HP for Medicaid claims. So I just wanted to make that clarification because some of the other folks had that question that had come up initially.
We agree. Okay. Do we know when that's going to happen, Sarah? Do we have a tentative date?
No. That's a good question, but yeah, no, we haven't really gone down that road too far yet because they were folks in healthcare reform were working on revamping the MMIS Medicaid claims system. And so I think because that's sort of on hold right now, we haven't continued to explore how we would connect SAMS to that yet, because there may actually be a new system in place sometime down the road. So, but we do know SAMS has that capability, so we'll keep that on our radar though, because I'm sure it would make things even more efficient for agencies. So,
okay, thank you.
Yeah, thanks. And I think we've had some folks from Beata join us, so welcome. So what I would like to do is essentially just do a demonstration for you, and then you know, after the demo or even along the way, since it's a small group that we have in the webinar today, just feel free to ask questions, and then certainly we can find out if, like, an at a glance would be helpful for you to help you go back when you're playing around in SAMS yourself. So for those of you who have been able to log in, you already know that you need to go to the https://login.harmonyis.net. That is going to be the web address that you use to get to the Harmony portal. So what I have on the screen right now, we call the Harmony portal. And so you'll have one login to get to this screen, the portal. On the portal, you'll see Harmony News. If Harmony is going to be making any updates to SAMS, then this is where they will post any notices about that. So you can see there's already a notice about some updates that they're going to be doing. The other place that may be helpful for folks, needing to access information for billing purposes, we have a Vermont SAMS reference manual. There's probably a lot of stuff in there that you're not going to need to know or would even be using, but you can certainly feel free to take a look at that as far as it has the login information and all of that in it. So that's just one thing I wanted to point out. For folks doing billing and or scheduling, you're going to be using SAMS differently than, for example, how the case managers use it within your agency. You're not going to be entering any information. You're just merely going to be looking for information and reading the information that's in there. So to get into SAMS, my application links list is a lot longer probably than all of yours, but you would have the SAMS 3 on your application links, and so you click on SAMS 3, and then it's going to bring you to a second login box. So you would have to enter your second login name and then password. I already have my SAMS open. And so once you do your second login and password, it's going to bring you to the main page of your SAMS. So mine probably looks different than some of yours because I have mine go directly to a dashboard. For the purposes of looking up program participants, it doesn't matter which screen you land on when you log into SAMS. So there's up in the left-hand corner is a white search box. This is the box that you're going to want to use to search for the participants that your agency is serving. So the way SAMS works as far as security settings go, if your agency is providing either a case management service or personal care or companion respite services, if your agency is listed within that client file for any of those purposes, you should be able to see that participant. So you can search for a participant by, the first few letters of the last name or the first few letters of the first name, date of birth, social security number, or you can use the SAMS ID. There's an ID that's assigned to each person once they're entered into SAMS. So if you have that, you could use that as well. For our demonstration purposes, I am going to pull up an aardvark. So you can see as I type in the first few letters of the last name and the first name, my laborious aardvark comes up. And I'm just going to click on the name. And it brings me right to this client record. So anytime you pull up a client in SAMS, it's going to bring you to this first tab, which is the Details tab. And you know you're in Details because the tab is highlighted in a light blue. So up at the top, you can see the address would be listed for the individual, the phone number. It's also listed elsewhere within the details. But if I want to, if for some reason you pull up a client and that's not there, it's because of this little arrow. Your little drop-down arrow is not clicked. So you can either choose to have this additional information shown or not. You can also see the date of birth and then the age is automatically calculated. Additionally listed in the details section is all the basic information, demographics. You're going to want to note care managers is the case management agency that is assigned to that individual. So this is how one of the permissions is set for you to be able to view participants associated with your agency. So if your agency was providing case management, your agency would be listed here along with the specific case manager name. The other piece of information in the details section is what we call care enrollments. And care enrollments show which programs the participant is currently enrolled in. And since this is a test subject, it looks like they're enrolled in multiple programs, which may not usually happen. But we would want to look for the LTC waiver home-based, or it would say LTC waiver home-based highest, like this does. And you can see that this care enrollment is active, and they've been active as of 1/27/16. So that shows that they are actively enrolled in Choices for Care. We also have listed here their residence and mailing address, and then the phone number. So you can change the format of how things are listed within your details screen, or any other screen for that matter. If you have a format panels option, you can click on this option and, for example, currently I have notes at the top of my screen. If I wanted to make that my care managers to be listed first, I would highlight care managers and click move to the top, and then click OK. And so now my care managers are listed first, and I bet my notes have moved right down underneath. So you can rearrange how things show up on your screen. So the next thing I want to show you, now that you know where all the basic information is, I want to go into the assessments section. So to do that, I'm going to click on assessments. And you know you're in assessments because it's highlighted with the light blue. And I just want to point out that, I mean, this is the section that the case managers and that the Dale nurses use, and where the assessments for the individual are kept. So the Vermont Dale Full ILA 15 is the document that's used by the Home Health Agency case managers. And then the Vermont Dale CFC LTCCC Utilization Review 2015 is what is used by the Dale nurses. So anytime you see a utilization review document in the assessment section, this means that the assessment done by the case manager has been reviewed by the nurse, and the final authorization of services will be included in this utilization review. So one way you can obtain information on what has been authorized for an individual for services is by looking in this document. This isn't the easiest way to find it. I'll show you another way, actually two more ways you'll be able to get that information. But I just want to point out the where the service plan is located. So you can double-click, highlight and double-click the document that you want to open. And so this is the full assessment form. So on the left-hand side, you have a menu. And to get to the service plan, it is at the bottom of the document. So you're going to want to scroll all the way down. Where it says service plan. So this section of the assessment document is the paper service plan. Essentially what we've done is taken the paper service plan authorization that you're used to looking at and have made it an electronic form embedded in the assessment. So on here is the info, there's the ICD-10 code, there's the requested plan of care start date, and then it goes through each section of the service plan to show the services that the individual is eligible for and has chosen to receive. So for example, for personal care, the individual is eligible for 44.75 hours every 2 weeks, and they've chosen to have home health. Just as an example, we just wrote VNA in here, and would like to have 20 hours per week of PCA services through home health for personal care. They also are going to use the remaining amount of their hours to have surrogate-directed personal care through ERIS, 24.75 hours every 2 weeks. So you can scroll, you can use your little scroll bar over here on the right-hand side of the screen to navigate through the service plan, or you can use your menu on the left-hand side and click on each specific service section. So this walks through personal care. The adult day is listed if they are going to receive adult day. There's respite, companion, and then it goes through some of the other services that they are eligible for and might use. But the sections that you would be focused on would be the personal care or the companion respite for the home health services. So once the hours are broken down into each service section, now that we're going to be using budgets, this last section of the service plan calculates the budget for each service. So for the purposes of home health, the services will be expressed in a budget format. However, nothing else is changing for you. So the budgeting really is for the purposes of our consumer and surrogate-directed employers. They are now able to, set the wage of their employee and use their budgets more flexibly than they've been able to use the service in the past. But for right now, for the purposes of home health, you're still managing, there will still be the hours that you'll manage for scheduling the PCAs, but it will be expressed in a dollar amount. And so we'll talk a little bit more about that. So this is sort of the summary where the budget, the dollar amount is expressed based on the hours that were entered and how they were broken down by the individual for the services they want to receive. So you can back up one step and then also see the service plan request hours summary. So it's another at-a-glance quick way to see how the hours were actually broken down and how it translates into dollars or a budget format. So this is just one place that you can access this information. And I'm going to show you the next place. If you're wanting to look in this, again, you highlight and double click it to open it, and then I just click this close button. And then if it asks you, do you want to close it now, you just say yes. And it brings you back to the screen where all of the other assessments are listed. So once the jail nurse has done the review of the assessment and the authorized services, when they're putting their final stamp of approval, I guess if you will, authorization on it, they then enter a care plan. So I'm now going to click on the care plan tab of the client file. So anytime a care plan is entered in SAMS, and we've been doing this all along, it It just means that these are the services that were authorized. So you're going to see the start date for an authorized care plan and the end date, and that it corresponds. You'll be looking for that LTC waiver home base, whether it's high or highest, and then the status is active. So again, you want to highlight the care plan to open and just double-click it. And here's where all of the individual services that that has been chosen and the person is authorized to receive. Only now, instead of it being expressed in hours, it's all going to be expressed in dollars. And we had to do, I understand, you know, for the purposes of home health, it probably would be easier to keep it expressed as hours, but because of the way SAMS works, at this point we have to express everything in a dollar amount, even though there's no difference in how it's being managed. So we may look at doing something down the road to make it a little more easier to read and understand, but for right now, this is what we have to work with. So for home-based case management, you can see it's home health. And instead of it saying 4 hours or 4 units a month, which would have been 4 hours a month, we've now just expressed that 4 hours in the dollars. So it's $277.60 monthly. So the quirky thing with SAMS is that it says units, but it's really dollars. Again, the next service is the respite care, and it says it's agency directed. And instead of it saying up to 720 hours a year, it's now expressed in that dollar amount. So if you take the $720 and multiply it by the Medicaid rate on file for that service for home health agency, it brings you to $15,926.40 a year. So you can do a backwards calculation, and I will put together a list of the current rates too, because that would probably be helpful for everybody. So you can take that $15,000 and divide it by the Medicaid rate on file, and it brings you back to the hours. So anytime you see that amount, though, it would be the 720 hours. But if somebody is not in need or doesn't want up to that amount of time, then the dollar amount will be different. And the same thing for personal care for agency directed. This just says, for training purposes, $650 biweekly, so every 2 weeks. So if you're to divide that by the Medicaid rate on file for personal care for home health, which I think is $27.70, then it would bring you to what the number of hours on a biweekly basis are authorized for. Also on here again, in the care plan, you can find the ICD-10 code, diagnosis code. You'll need that for billing. And then you'll also see any other services that the person has been authorized to receive. So this is probably going to be the easiest place to go and check and see what the individual has been authorized for. So initially, we thought we would be printing a separate care plan, printing a copy of this care plan for all of our participants, but we found the way it is, because it's quirky in SAMS, it's not really easy to read or user-friendly, because we don't use any of the monthly costs, and all of that information was showing up on there. So what we have done, and should be ready for testing by the end of this week, we're having Harmony, so the company that manages SAMS, create a custom care plan report. And so this custom care plan report is going to basically pull all of the specific services that were authorized here in this care plan section into a report, and it's going to be outlined in a nice, really simple line-by-line format, still expressing the service, the agency providing the service, and then the dollar or budget amount that's been authorized for that service. And the nice thing about this care plan report is that it's something that our Dale nurses can use to print page by page when they're authorizing services for the participant. So they'll get a copy of that in the mail with the notice that we always use. But it can also be used by all of our agencies. So for home health, you could print this custom or run this custom care plan report on a periodic basis. You know, I'd want to leave it to your agency to decide how frequently. But essentially, you enter in a status date. So if I wanted to know as of, you know, yesterday, who's been authorized for services that my agency is serving, you would be able to run this report and see who was authorized for services and what services and the volume of services that were authorized for that individual. And so if you wanted to, you could print off a report by individual, or you could run the entire report for all the people that you're serving within your agency. So it's going to see who's newly authorized for services, and then also if there's any, if there have been any care plan changes done, you would be able to see those care plan changes reflected in that report as well. So we are expecting that Harmony will have this ready for us to test by the end of this week and be able to have it ready for all of you to use for the following week when we move to budget. So that way you can start running the reports, and we'll be doing instructions to go with it too. And it's really quite simple. So I'm just going to close. I wanted to show you where reports are. I'm going to close out of this care plan section. And so outside of the client record, up here are at the top of your screen are additional tabs. And if I run my mouse over them, they're going to be highlighted in this orangey color. And so one of the tabs you should have is called Reports. So when I click on Reports, you can see we have a lot of reports in SAMS, and they're all broken down into different report types. And so next to report types is a drop-down arrow. So you can see these are all the different kinds of report types that we have. The report that we would want you to run would be a care plan report. And so we will be including instructions for you as to how to filter for the care plan reports and then find the one that you would be able to use specifically for your agency. So once I filter for care plan reports, I already have them showing up in my list here. The top section shows all of the different care plan report types. Then if I click on one of the types, let me find one that has additional. So if I click on one of the report types, you can see all of the reports underneath that have additional detail and are pulling specific information that we're looking for. So essentially, we'll include instructions on how to filter for a care plan report, which report type you need to click on to then get to the report with a definition to run for your agency. So we will be writing up some instructions with screenshots to help you navigate that. But I think that will be a really nice, easy way for you all to see the services that were authorized. And that's currently what we have been using actually for a couple of years now with ERIS. That's how they receive all the information on service authorizations for consumer and directed services. So are there any questions right now that folks have?
Hi, Sarah. This is Rachel at Home Health, or Addison County Home Health. So when I call Susan Winston and ask her questions regarding a patient, you know, if I get a denial or something, it's how does her information and the SAMS information, where are they merging? I mean, how does it, when she goes through an application, how does the information when she does the approval get to SAMS?
Yeah, so yeah, there's, and I'm not sure, we'll have to look at what your permissions are, what you can and cannot see in SAMS, but so if I want to go back to my consumer, I'm going to show you right here. You can go to this recently opened tab, and you can see folks that you've had recently opened and click on the name. So I'm back in Aardvark. We do have a section called File Attachments. And this is where the notices of decision from DCF Economic Services are attached by the Dale nurse. So when the Dale nurse is notified that they're eligible for Medicaid, we attach that notice right there. Once they attach the notice in SAMS, you can see this is a demonstration person, so I don't have one in here. But once that notice of decision is attached, the nurse goes into the details section and then changes the status of the care enrollment to active. So for purposes, that's a great question. I'm just going to show you if somebody has a care enrollment for Choices for Care, but is not currently active, you're going to see let's see, a status of pending Medicaid eligibility. So one way to know when somebody becomes active is that the status of the care enrollment will be changed to active, and there will be a start date. And so this is what the Dale nurse does. So you'll see it right there. So that's right now how the DCF, the Medicaid information gets into our system. What I'd have to check on, though, is just to see if you would be able to actually open the file attachment that is the DCF notice.
Yeah, and this is real. You cannot see it or cannot access anything. Let either Sarah or myself know, and we'll go take a look, like she mentioned, the permissions and things like that, and we'll straighten that out.
Yeah, because that's a great question. It sounds like that would be really helpful for you all to be able to know where to find. But essentially, if the status date would, or the status of the care enrollment would say either pending, if the application was received, and the nurse had not done the assessment yet, and you may not be able to see any of those people until we assign the case management agency. So you'd most likely be seeing the care enrollment status of pending Medicaid, in which case we haven't received the notice of decision yet, or it would be active with the start date because we received the notice. Does that help you, sir?
Yeah, definitely. And is there anywhere in the SAMS as far as the patient share, or do you have those notices as well?
Yes, so usually the patient, if an individual has a patient share, it's listed on that notice of decision that we attach in file attachments in SAMS. Yep. And I think we've done training with the case managers as well. So, they should be able to see those attachments. But of course, if for some reason you can't, let us know, because we're going to still need to figure out, because your role is a little bit new using SAMS, we may have to do some tweaking with it to make sure that you're able to see what you want to see to help you in your work that you're doing.
Mm-hmm.
So yeah. What triggers the Dale nurse to go and update that status, though? Is she the one uploading the attachment, and then the next step is immediately changing the pending Medicaid to active? Or are there two, what triggers that?
Yes, that's what triggers it. So the way the process works is that economic services, as soon as somebody is deemed eligible for long-term care Medicaid, they email that notice of decision to our Dale nurse. And the Dale nurse, attaches that into SAMS, changes the care enrollment, and then enters the authorized care plan.
Okay, so they should go hand in hand.
Right. Yep, exactly. Yeah, and I think all the nurses pretty much have a similar process down. You know, once they receive that notice, they want to go through all those steps to make sure that that individual's file is now complete and that they're active and on the program.
Okay. Thank you.
Yeah. Are there any other questions? So do you all, those of you who are participating, do you feel like this is going to work okay within your agency then, just having access to SAMS, being able to run the report?
Yeah, this will help. It'll cut down on phone calls and contact with Mary Scarborough if we're going back and forth and all of that. So it'll certainly make that more, more seamless.
Okay, great. And certainly, as we dive into this, it is something new. I'm sure there's going to be little bugs here and there that we need to work out, but just let us know if you do run into any issues, if something's not working for you, what could work better. I mean, our goal is to continuously, find additional efficiencies, improve our process, and ultimately, ensure that the folks that we're serving are getting what they need in a timely way too. So we're always open to that feedback.
Yeah, I mean, I guess our biggest concern would be the database itself in terms of the increased volume going through the database and whether, the database can support that in an efficient manner. We don't get kicked off and have delays and all of that, which our case managers currently experience. That would be our biggest concern.
Yeah, okay, so let us know if you are experiencing that. I mean, I haven't heard anything from the nurses having issues. I do know sometimes SAMS can just be, sometimes it's our network too that can just make things a little bit bogged down. But definitely keep us posted and let us know if you are running into issues continuously. And then we'll see if there's a way to problem solve that. Because yeah, we don't want to create more, we don't want anything to be inefficient or be extremely frustrating. So.
Sarah, I have a question for you. If, for example, an individual consumer changes case management from the AAA to us, for example, can we see running totals or fairly current running totals of case management units or dollars that are left?
No. So there are a couple of AAA agencies right now that are piloting switching over to SAMS, entering all of their case notes as case manager notes as a journal entry in the client file, and then they're keeping track of their case management time in a service delivery, in the service delivery section. So if you look at the screen, so they're going to journals. I'll show you. There's actually a case management. So if I add new, there's a new journal type for, where's it, case management. I thought there was a new journal type for, here it is, case management notes. So some of the AAAs are actually entering their case management notes under this journal type in the client file in SAMS. And then they're going to this section over here called service deliveries. And, oops, there's nothing to save. Discard my changes. So then they're going over to the section called service deliveries. And there's a way to keep track of the number or the amount of time essentially that they're spending on choices for care case management. And they're able to track it that way. And then I think their billing folks are able to go in and see that and bill accordingly. So, certainly if there are other agencies who are interested in tracking it this way, I would suggest maybe chatting with Dick and Rio because they have been more involved, I think, with the AAA agencies who are starting to do this. Does that make sense,
Sure,
Rio?
yeah. We're just going to have to get the whole, how it all's going to fit together. So if we can hear feedback on what works, we'll see if it's doable.
Yeah, yep. But I know for home health, I mean, you have I know you have, well, it depends on the person's also receiving home care services. You have the Oasis, right, if it's a Medicare, and then you also maybe have another system, too, that you use to track information.
Well, the reason we asked was because sometimes at the end of the year, case management time, all of a sudden we might run out and not sure why, and then we find out that, you know, at the beginning of that year, it was used elsewhere and we were unaware of it.
Yeah. So usually, I mean, right now, the best practice is for the I guess, sending case management agency to inform the receiving case management agency how much time has been used. However, I know it sounds like that doesn't always happen. And so you find out after the fact. Yeah.
Yeah, Sarah, this is June. I think that sometimes the current case manager will communicate the hours that she's used, but if she's had the case transferred from a previous case manager, that's sometimes where those numbers get a little blurred.
And the only way of us tracking it is to actually call HP and ask basically how many hours have been paid or billed elsewhere, so we have an accurate count.
Yeah, exactly. And I was going to say that's really the only way that if we were able to run something from claims to say for sure, until, you know, if all agencies agreed that this would be a good way to track case management hours using SAMS, you know, we could head in that direction. But until then, yeah, it's going to be through claims.
Is there a thought eventually, Sarah, that as agencies are utilizing time, regardless of this particular option, that there will be a running total of either units or dollars that are left within the system that could be viewed?
Sorry, could you repeat that, June?
I'm asking that if eventually the thought is that the service dollars or units, there will be a automatic deduction as those dollars are used throughout the course of the year.
Right, so it just be as it is today, you know, how you're tracking the hours that are used. Is that, maybe I'm not quite understanding what you're asking.
I'm asking if it's going to be like an automatic calculation, similar to what we've done with a worksheet. We've had an automatic calculation that converts hours to dollars. Is there a thought in the future that there would be an automatic deduction or subtraction of dollars for these services throughout the course of the year, so you could get in at any time throughout the course of the year and see what the balance of dollars or hours are left
based on what we've billed through HP, right?
Right. Oh, yeah. I see what you're saying. I see what you're saying. So yeah, no, I don't think that would be able to happen unless all agencies were maybe using, you know, service deliveries.
I don't think SAMS has the ability to do that.
Okay. And Rio was just saying we're not sure that SAMS has the ability to do that subtraction unless we were maybe to tap into like the billing function, which we haven't done yet. Yeah. So yeah, I think we're all on board for getting as technology savvy as we can, because it does create a lot more efficiencies, but we're just not quite there yet.
So the beginning of this that we were looking at, and it was showing the breakdown monthly, yearly, biweekly.
Yes.
That isn't deducting the times or units or hours used as we go along?
No, this is just saying what has been authorized.
Oh,
for
so
that
it's not
time frame.
calculating it as we use it. It's just showing us that.
Right.
So that's just basically what the sheet says, and then we do the calculation ourselves.
Yeah, and I think that's what you do today, because right now we authorize the full amount that's authorized, and your agency must have a mechanism already.
Keep track of it.
Yeah. I mean, it would be great if we could do some more with SAMS to make it more automated, and that's where we would like to go. But it just kind of is where we are today, and certainly that's on our wish list to make things even more automated.
On the SAMS under care plans, when it's listing the consumer and it's listing there that the total dollars amount and it says delivered, that's not an area that could automatically calculate according to what's been built through HP, or it's not set up, the program's not set up to do that?
Yeah, it's not connected to HP, but what if you're entering service deliveries, so in the service delivery section of SAMS, I know it's connected to the care plan, and I think that's where it might actually populate what was delivered. And so this is a thing that we're just starting to explore with the some of the AAAs. They were interested in tracking the case management time. So I think I can certainly have a conversation with Dick and Rio about, how does this relate to the other services that are being delivered? Because if that in fact would then deduct what is being delivered, then that sounds like it would be useful for other agencies. Does that make sense?
Thank you. Yes, it does.
Yeah.
Thank you.
Yeah, no, thanks for bringing that up. So we'll look into that. Any other questions, comments?
Sarah, I have a question about reports. Can you generate by agency and then also by case manager individual reports as to the consumers that they're currently serving?
Yes, we can, and we do have some reports that are already existing that list the care managers or case managers, because I know that's one thing that that probably needs to be cleaned up a little bit too in SAMS is the correct case manager with the correct client.
Mm-hmm.
Yeah.
Yeah, and that would come through the LPCCC and reporting to her. Is that where that originally starts, or will that eventually be something the agencies will have the accountability for?
Well, I think if we could make it available to the agencies, that would be ideal. And I think we had talked about allowing agencies to update the case manager in SAMS as well, because you're going to know firsthand, if you have a case manager taking over a client, that you would be able to just assign that case manager to that individual and it would be fixed. But I'll have to check in with Dick and Rio about where we're at with who has permission to do what things in SAMS.
Okay.
But I know we have talked about that. But in the meantime, yeah, a report.
So on the report, does it show which cases are in pending status and which are active, so we could run a report by case manager that says these 5 cases are still pending?
Yeah, yes, there should be able to run reports that are by case manager who's pending Medicaid and who's active. Yeah.
Yes, there are. If you've never worked with the reports before, however, when you want that, give us a call and we can walk you through it, because it's taken me quite a while to really figure out which report is needed and how to open it and exactly which parameters are needed. But there's also, and it's kind of beyond the training here, but there's also probably some widgets on your dashboard that we can walk you through for that. But again, that would be separate for this. But by all means, send us an email with what you're looking for, and we'll try and get you set up.
Okay, that sounds good. Yeah, I just want to make sure that as the billing end of it, we're going to have access to those reports, that we can, again, work with our case managers and get the status of things. Because that's what's most time-consuming on the agency part is, again, the waiting, the timing of, where do things stand in the process. It's very, very difficult. The case managers are out handling cases, and we want to be able to be their eyes in the database.
Yeah, no, that's great, and I'm really glad that you're bringing that up, because this is the kind of thing we wanted to hear as a result of these trainings too, to really figure out and hone in on what is going to make it have the most impact for you and get you the information in the most timely way. So this is really great.
And it could be like a process. So I mean,
yes.
This is Rio, and just to let you know that because this is still a relatively new process for us, like Sarah had mentioned, there will be a little bit of growing pains, but the more that we know that isn't working for you, the easier it's going to be for us to fix it and tweak a few things. So any problems that you guys run across, please let us know.
Our help desk for the database itself, is that Dick? Is that, who do we go to when we are having issues getting in or out of the database?
Yeah, that's a great question. I think Rio, do you want to?
Yeah, that'll, first, it kind of depends on what the problem is, but your first step, just call or email Dick and I, and if it's something that we can do, we'll take care of it. If we have to pass it off to Harmony, we will send you an email with the Harmony customer support. But usually, probably 9 times out of 10, it's something we can fix. So just give us a call first, or an email.
Okay, Rio, because we have had some concerns about SAMS and some questions, and we've emailed Dick and not gotten a response for like a couple weeks, sometimes longer.
I'm sorry, he was on vacation, and that's kind of another point that I wanted to bring across. When you email one of us, copy both of us, because invariably, like I said, if somebody just emailed Dick when he was on vacation, I never got the email and I could never see it. So just make sure, think of it as like a, a dual purpose thing. Just email both of us.
Okay, if you could send me that email, and then I'll forward it to our IT person, because as we have issues and concerns, obviously we resource them, and if we have that email I can forward to them, then that can be a template for all of us.
Yeah, I'm going to do it in the chat right now.
Okay, yeah, and I will, this is Sarah, I'm going to send out a follow-up email. Since this is the last webinar that we're doing this week, I want to send out another email to all of the group, and I can include Rio's information in that as well. I just want to summarize kind of the highlights from all of the webinars that we've done. I've recorded all 3 of them, I think, successfully, so I will try to post them in a YouTube somewhere as well and provide the link to that. So if there are other folks who missed it, that way they can watch it.
And I just sent them all through chat, so
okay. Yeah,
you'll get it plenty of times in the next few weeks.
Okay, thank you.
Yeah, that'd be great. So we actually have a fair amount of experience with this database. I mean, I know it's changed a little bit over the years, but we've been working off of these databases for a while as an agency. So, I mean, we've had the stumbling blocks, and we very much want to use this wholeheartedly. So we definitely want to see the support on the other end of it.
Oh, that's nice to hear.
Yeah, great. Yeah, it's exciting to know that you're interested and want to learn it and get really, really comfortable with it. So that's great. All right. So any additional questions or comments?
No, I think we're all set for now, Sarah. Thank you.
Okay. So yeah, if anything does come up as you're working in SAMS, again, you have Dick and Rio's contact information, or if you have questions, you can email me as well. And so I'll send out a follow-up communication just with some highlights on things that next steps as a result of these trainings. And hopefully we'll get the testing done this week, by the end of this week. We hope, beginning of next week, for the reports, and that way we'll have those ready to go in time for you for the transition. So, all right. So it looks like we didn't even need the full 2 hours either, so I'm sure everybody's happy about that. I know everyone's busy. So okay, so just let us know if there's anything that comes up in the meantime, and thank you all so much for participating.
Okay, Sarah, thank you.
Thank you.
Thanks, everybody.